Hi, welcome. So we've had a great lineup of panels so far. We've heard buzzwords of AI and healthcare, but what about another hot topic, blockchain and health? My name is Sarah Mock, and I run accelerator programs for startups in health and Web3 at Brinc, and I'm honored to be moderating this session today. So, I want to throw a question to the audience first. How many of you here are familiar with the concept of blockchain, in particular, how blockchain is leveraged in health? If you can raise your hands. Okay, so maybe half of the room. So maybe it's a good idea that I give a quick introduction as to what blockchain is. So simply put, blockchain is a shared ledger verifying and recording transactions, where individual blocks of data are lined up in a sequence such that each relies on the one before it, hence the term blockchain. So let's take this quick analogy. Individual blocks of data are a glass box, and you have a vault with a series of glass boxes which are similar, and everyone can see through it and verify the content inside. But only the owner, which has a unique key to it, can identify which of those boxes are theirs. So any changes that are made to this block of data can be verified by a group of users. So any attempt to hack can be quickly flagged and remedied. So ultimately, this shared database can be distributed in a transparent manner, rather than being copied across multiple computer networks. And so what really makes blockchain compelling? I guess it really comes down to a few main things. It's decentralized, it's permanent, it's secure, and it's transparent. So enough of me talking. Let me introduce the panelists here today. So on the left, we have Dr. Marten Brelen, Associate Professor at the Chinese University of Hong Kong. Maybe you can please introduce yourself and tell us how blockchain is revolutionizing the industry for you.
Great, thank you. Yes, so I'm an associate professor at CUHK. I'm a doctor, I'm an eye surgeon by training, and therefore a slightly unusual panelist perhaps to have today. But I'm here because I have a research interest in digital health technology, and in particular how we can use blockchain to fix some of the sticking points that we have as healthcare providers in the services that we provide every day. So I guess my story started off actually during the pandemic. I received a research grant from the government to build a digital health passport using blockchain technology that was based around the principle that each individual could keep self-sovereignty of their identity, and they could keep self-custody of their data, namely their COVID-19 credentials, and then share that in a peer-to-peer manner. And that really started the journey for me, and has now expanded the project into a startup which will be shortly launching in the Science Park, which has now become a global decentralized healthcare network. It's still based on the same principle of individuals keeping self-sovereignty of their identity, particularly for patients to remain anonymous and secure on a network, and then being able to share data, namely their PHIs or private health information, with the individuals on the network that they choose to share that data with. So more specifically, that would be, let's say, your healthcare provider, your doctor that you're seeing that day, or, for example, the industry. So, for example, the insurance industry or pharmaceutical industry. The beauty of a platform like this is that you give autonomy and control to patients. So they're able to control their data, and they're fully in charge of who has access to their sensitive PHIs. So that's what led me into blockchain. Thank you.
Yeah, so that's something that's much needed, and so your work that you're doing is really inspiring. Next, we have Mr. William Yeung, from CEO and co-founder of MediConCen. So how are you using blockchain?
Good afternoon, everyone. We are using blockchain for insurance claim processing. I think one part of the difficult part between different insurance companies and between different hospitals and different medical providers, they need to share information in order to process the insurance claim efficiently. But currently, everyone got their own system, and that system actually are not always in sync. So using blockchain technology, we allow all the insurance company and all the medical provider, they can have a single source of truth that everyone can agree on, and without the need of reconciliation between different parties. And we want one day that the REST lecture will become a thing of the past. And no longer we are using paper to transfer very sensitive medical information. Yeah.
Yes, you're right. Interoperability is such a key main word in this. And we've got Mr. Varun Panjwani, CEO and co-founder of MetaCare. We've already heard 2 different use cases. Are we going to be hearing another one?
Thank you. So at MetaCare, we actually provide retail individuals access to corporate pricing for corporate benefits. The primary benefit, obviously, is insurance that most people are looking at and is generally an underinsured market across Asia Pacific. To this market, we don't speak about blockchain at all. Instead, we look at blockchain as a technology stack and how can it improve processes there. And so for us, we're actually seeing, like the earlier session, our payers and our market is the insurance providers, and they're more interested in the blockchain space and what we're building. And the benefits there are twofold. One is insurance fraud, specifically on what the industry likes to call first notice of loss, so that there's no double claims and multiple claims. And so the blockchain allows for verification of that element. And then the second is, as individuals or even within corporates, as you've got movement across different employee pools, how is that information, risk profiling, claims, impacting the pricing of insurance and reinsurance? And so we're really looking at the longevity of what blockchain can do for the industry. But as a user onboarding, our product market fit is onboarding the retail user and giving them access to corporate pricing, which is our hook in. On a user engagement, the one element that blockchain is really accelerating on the adoption side is what has kind of gone a bit shy in this year is tokens. And so whatever's happening in the tokens and the crypto space is really just another way of saying gamification. And gamification now brings a new element, and the blockchain allows for accelerating user onboarding with incentives. But that, I think, is to be seen on how the market evolves and what happens in regulation there. But at the basis, blockchain for us is really for the industry itself to leverage on pricing, transparency, and risk assessment. And for users, it's just unlocking product market fit to a new demographic and onboarding them without mentioning blockchain specifically.
Thank you. It's so clear from all these 3 different cases that blockchain is disrupting or revolutionizing the health industry. But some may say that the health industry compared to its counterparts of finance or e-commerce, it's slower compared to these industries when it comes to adopting new technologies. So what are some of the challenges that you have seen when adopting blockchain in health industry? And what do you propose that we can do to overcome this? Maybe we can start off with Marten.
Great, thank you. I think, as you say, blockchain will revolutionize healthcare in due course. But I agree also with the comment that if you start off with your tagline that we're building on blockchain, people sort of tend to get a little bit apprehensive. The technology is very new, and some of it slightly uncharted still. I think one of the biggest problems that we face with our product when we're trying to onboard patients is really trying to get them to understand, first of all, why they need the technology, but then also how they use it. Because if you ask, any random patient coming into my clinic, can you please set up a Web3 wallet, and then write down your seed phrase to make sure that you keep your private keys safe, and then integrate that Web3 wallet into our product, I think they would run a mile. I mean, it would be too difficult. And I have to say, most doctors would also find that very, very challenging. So I think what we're faced with at the moment is using the technology but simplifying it so that it gets taken away from the more common use case of cryptocurrencies and used more for what we need, which is more data storage solutions and keeping privacy and keeping security. And this requires us to build bespoke interfaces that are easier to handle and easier for people to onboard and easier for people to use.
And William, from an insurtech perspective, what do you think? Do you agree with this?
I think blockchain, the technology is more and more comprehensive. Before it's very experimental, but actually the technology-wise is now mature. I think for the insurance industry, they always want to test and try that technology. I think the spirit is to introduce blockchain into insurance industry, but then they are also restricted by the risk tolerance level. How can I apply my traditional kind of security principle? I know the data is encrypted, but how can I verify that it's very secure? And talking about the data is lying across different servers. It's some concept that they are new to their security people. And so we do a lot of work to do what we call a pragmatic implementation. So we only store those sensitive information in an encrypted way so that you cannot identify the real individual. So we lumber all the people and remove all the PII so that only the party that have access to the real identity would be able to understand the data, even if the encryption is broken down. So this gives another security level to the insurance company so that they can adopt step by step. So I think in Hong Kong, we are the only one who are in production who process the insurance claim currently. So and we do a lot of work of explanation to different security people and even sharing to the insurance authority. So it's hard initially, but I think the technology is well proven. And one day the adoption will be gradually more.
I think you raised a really good point about building awareness, really educating everyone that blockchain is actually, you can achieve data privacy there. And Varun, what are your thoughts?
So I agree with both panel speakers, but I would put it in 3 different anecdotes. In terms of technology awareness and maturity, actually since 2018, Singapore Airlines has been using the blockchain to allow you to use your airline miles to pay for gas station purchases. So it's been happening for some time and it's being tested and throughout. In terms of specifically the Web3 and aversion to adoption in the healthcare, I think it's who you speak to. So definitely doctors and hospitals are secondary and slow at adoption, but that's because it's then critical care and care delivery. However, if you look at the insurance industry, there's 2 different components to this. So we operate primarily in the Philippines. Why? Because esports was the first industry to move to Web3. And our proposition in the Philippines, the large corporates from across all spaces was, there's this new demographic that you're not reaching. We're opening up a new demand pool for you. Do you want to participate? Your best case scenario is you have new users. Your worst case scenario is you have free branding and awareness. And at that point, we are taking the Web3 stigma risk, not the corporate, and they're outsourcing that risk to us, which helped. The second component is actually we're seeing the largest number of insurance inquiries for the technology, not a go-to-market, but adoption and tech stack, actually up from Japan. And so we've had 3 different insurers come and look at how to innovate and what they can do. And there, the MNCs are quite keen to figure out how they can bring new revenue streams and enhance the insurance offering. So it's actually been different based on which geography across Asia Pacific.
That's super insightful. Actually, so besides data privacy, building awareness, there's a lot of talk about private versus public blockchain. Maybe I could throw this question to you, Marten. Maybe you can give a brief introduction as to what exactly public versus private blockchain really is first, and then we can go through the panelists and see what your perspectives are and what's the right move in health.
Yeah, great. So very simply put, they're both distributed ledger technologies, but in the private blockchain, you have a known set of node operators. So a node operator keeps an entire copy of the distributed ledger. So it tends to be one company or a set of company or a set of institutions that want to distribute a ledger between themselves. And so it's very constrained within who can join and who can run the consensus algorithms. So the validators who provide the consensus to write the next transaction onto the block are also known validators. And if you want to join a private blockchain, then very simply put, once more, they are broadly speaking permissioned blockchains. So you need to be a validated person. They need to know who you are in order to be able to interact on a private blockchain. Now, public blockchains are sort of the opposite end of that spectrum in that they are permissionless, and anyone can really join and transact on a public blockchain. You can also become a node operator. You can, for example, download some software, run a node on your computer at home, and then start partaking in the consensus algorithm. So from that point of view, they're a lot more ubiquitous, much more transparent, and much more open for people to join and for people to interact. And as a general rule of thumb, most cryptocurrencies are based on public blockchain technology. The reason for perhaps talking about private blockchain still within healthcare is because sometimes you don't want some of the data that's being stored on blockchain to become public knowledge. But you run private blockchains then on the compromise that you're essentially creating a very centralized solution, which goes against the ethos of what blockchain technology is. So it's one of the main criticisms is that if you're running a little bespoke private blockchain between a set node and coordinators of that chain, then perhaps you're not decentralized and open enough to be able to be inclusive. So we've got a little bit of experience running both of these. We started off building on private blockchains, and I have to say probably the learning point for me was that the private blockchains are kind of quick and easy to set up. You can spin up your own nodes quite fast, and you can certainly then delegate validators on that. So they're quick and easy to do. But then trying to convince patients that you are open and transparent and secure is then very difficult. So hence the reason why we've moved sort of 2-3 years ago onto exclusively building on public blockchains.
Okay, how about you, William? I understand that MediConCen is on a private blockchain. So are there any reasons for that?
I think I would agree. Actually, public blockchain is kind of a very ideal solution. I like to describe public blockchain as a global IT system that everyone can use and everyone cannot control. So once you write a logic on the public blockchain, it is there and forever like that. So unless you can ask all the people who are running the log to change, you cannot change that logic. So it's very, very secure and very, very public. But then we use private blockchain is because the client and the nature of the data that we process. The data that we process is very sensitive, and also the ownership of data is also by a limited party. So let's assume you go to hospital and you want to process a hospital claim. Actually, the data belong to the hospital and belong to the insurance company. And they don't want to have even how remote, they don't want to have a chance that the data will be seen by other party. So the existence of a public infrastructure that everyone can get hold of a copy is not yet acceptable to the participant. So I think it's a transition from centralized to public, and the private blockchain is in middle. That will yield most of the benefit, not all of them. But it's good to convince the player to do one step further, and that is a big step ahead already from my system to a consortium of a system. And I think it's this, that would be how the world would slowly move up. And I can't say for sure the public blockchain is unbreakable, even as a blockchain industry people. With the quantum computer, one day it could be breakable, and who knows the future. So it's as an insurance executive, we are very prudent, and that's, I can understand the reason why the insurance industry is not that acceptable of a public blockchain. Yeah.
So maybe it's not just public and private, there's something in between. So Varun, any thoughts, public or private?
So I don't have specific thoughts on that. We're using a public, but what I would kind of say on the public-private space is you're basically doing a trade-off on cost, speed, and the costing is both cost of setup or cost of transaction. So I would say look at your business model. The reason we're indifferent is, despite being in healthcare, data privacy is less critical to us. And I say that controversially because what we're looking to write on chain and what we're looking to keep centralized are two different elements. Whatever we're putting on chain and whatever is important to the insurers is data insights. They want to know you had a fracture. They care less about whether it was your pinky toe or your first toe. They're not operating surgically on you. They don't need the x-ray itself. So a lot of data we are not writing to chain. We're only writing elements that we find critical for pricing of insurance and repricing of insurance. And then you have to decide at that point which elements are identifiable or not and how heavy they are and whether they need to be public or private. So I would say when you're looking at these questions, really it's the business model you're running and to question how much needs to be on chain and how much doesn't need to be on chain, and that might drive your decision making.
Thanks, Varun. So whether it's private or public blockchain or something in between, it's just clear that blockchain is just so important, and its vast applications in health are really exciting. So we look forward to seeing how we can bring these blockchain solutions in health one step closer to reality. So can you please join me in thanking the panelists here today for such a stimulating discussion?